Whereas the County of San Luis Obispo holds a vision of healthy community where children and families have access to basic necessities. And whereas oral health is an important and integral part of a child's overall health and dental disease is highly preventable in children. And whereas drinking fluoridated water keeps teeth strong and reduces tooth decay by 25%, on average, communities with fluoridation experience a return of $20 for every $1 invested. And whereas studies have shown that every dollar spent on preventive dental care could save up to $50 in restorative and emergency dental treatments. And whereas several registered dental hygienists in alternative practice working in our county provide preventive dental services in schools and in private offices, their work helps open chair time for treatment at Medi Cal Dental offices by providing preventive services. And whereas state funding dedicated to oral health was used to address local oral health needs and enable preventative dental visits to be provided to school-aged children by RDHAPs, which included teeth cleanings, sealants placed. And whereas the county oral health program provided dental screenings and fluoride application to children in the community, and whereas oral health providers and school nurses will honor Children's Dental Month 2026 by contributing to Give Kids a Smile efforts through the county that will provide free dental screenings to children, last year seeing over 10,000 children. And whereas the Central Coast Dental Hygienist Societies, let me say that one again, whereas the Central Coast Dental and Dental Hygienist Societies, the Medi Cal Dental providers, First 5 SLO County, Center for Family Strengthening, CAPSLO, and other community partners work together to help address dental health issues by supporting the county's oral health program. Now, therefore, be it resolved that the Board of Supervisors, County of San Luis Obispo, State of California, does hereby proclaim February 2026 as Children's Dental Health Month and supports community efforts to improve access to dental care so that all children have a dental home where they receive regular dental care.
Manager, and my team is here, Esmeralda Cantu-Smith and Amber Carone. We'd like to thank you so much for this recognition. So much of our work over the past years has been dependent and successful on our community partners. So today I'd like to introduce Alexandra Chamberlain from Tolosa Children's Dental Center to just say a few words on how we work together and how important our collaboration is.
Good morning. I'm Alexandra Chamberlain, Executive Director of Tolosa Children's Dental Center, and thank you so much for this resolution. And that was a hard act to follow this morning, but that really speaks to the community with which we live in and how important and the integration of the services that we provide to our community members, children, and adults alike. February is National Children's Dental Health Month, and what began as a one-day observance in 1941 grew into a month-long celebration in 1981. Dental disease is the most chronic infectious disease among children, more than asthma, diabetes, and obesity. Children in pain from untreated tooth decay experience all kinds of difficulties eating and sleeping and struggle at school and can often experience low self-esteem. The community need for pediatric oral health care is directly related to the barriers of accessing dental health care, especially here in San Luis Obispo County. And access to care also contributes to the high caries rates found amongst the youth population. Almost half, 46% of SLO County's Medi Cal beneficiaries are aged 0 to 21. And only about half of these Medi Cal beneficiaries use their Medi Cal dental benefits. San Luis Obispo has significant oral health disparities, with low-income and minority children carrying the burden of oral health disease, and Hispanic children have a higher prevalence of decay experience and untreated decay. In the United States, over 51 million hours of school are missed each year due to dental-related issues, and the myriad of barriers for accessing oral health care, including transportation, language, cultural, education, financial, and limited providers. The linguistic challenges also can impact a family's ability to navigate the social and healthcare systems. For the past 23 years, Tolosa Children's Dental Center has been providing care to underserved and underinsured children throughout our community. There are a lot of changes happening at Medi Cal dental eligibility that are affecting families here on the Central Coast. At Tolosa Children's Dental Center, we have expanded our sliding scale cash fee to help bridge that gap a little bit further for families that have lost eligibility so that children can still access really critical oral health care. We're actively expanding our dentistry at school program, which was mentioned in your resolution. We are expanding into San Miguel. Hopefully our target will be that we'll be seeing children at school toward the end of March, and also have our program still in Shandon. Our county works together in collaboration with multiple agencies providing to work toward bridging the gap to provide accessible oral health care to children in our community. A big thank you to the County Oral Health Program, the Central Coast Dental Society, First Five, the community workers, Give Kids a Smile, and the many other agencies that come together to reduce barriers to care to help children in our neighborhoods have healthy, happy smiles. Thank you to the Board of Supervisors for supporting National Children's Dental Health Month, and we hope to continue to giving care to the children who need it the most in our community. So thank you so much.
Thank you, Ms. Chamberlain. Any members of the public wish to speak on this item? Okay. Seeing none, I'm going to bring it back to the board. Any board members like to make a comment on this item? Supervisor Gibson.
Thank you, Mr. Chairman. This is an extraordinary program. It seems simple, and it is really, in a way, that we're going to try to reach out to children before their problems become debilitating. What a great concept, stuff we should be doing more of. And it's been my pleasure over the years to know this has been going on for a long time. It's probably been going on for 30 years, close to it, at least 20. Yeah, longer than any of us can remember. And where I came in contact was during my time as a First Five Commissioner, knowing that that is something that the First Five Commission is guaranteed to invest in. And so really appreciate those who do this work because it makes such a huge difference in kids' lives. And thank you.
Supervisor Ortiz-Lake.
Yeah, I'm so glad we do this because it really brings forth some of the basic issues. I mean, like Supervisor Gibson said, it's simple, but yet it's not quite as simple as people think. Transportation, all of the pieces, timing, just understanding the importance of dental health, and then the long-term ramifications when it's not there. This is really important work, ladies, and I'm so grateful for you. And on behalf of First Five, we say thank you for getting out there. We're so happy to support, and also from the county. So, keep it up. And it made me think of a whole bunch of things. So I'm really happy that you're here to talk about it.
Supervisor Moreno.
Yeah, I can remember when I was in elementary school, learning about dental health, and we had just a toothbrush on our little desks that we had, and we would, just dry brush our teeth whenever. And I'm grateful for that because I know personally, just when I compare my husband and I, and my brother and my sister-in-law, we have very different genetics when it comes to teeth. My husband, if he was so inclined, could literally brush once a day and have no problem whatsoever. Yours truly brushes 3 times a day when possible, flosses twice, and water picks daily. Took me a while to grasp that I had to do all of that. But to learn early on how to take care of your teeth is so important, especially if you had a genetic predisposition, thanks, Dad, that you need to really work on it. So thanks for what you do.
Supervisor Pashon.
I want to thank you for all you do for the community that I represent. Shandon has been a tremendous success, and I know the San Miguel is coming online. I'm a grandson of 2 dentists, and so I really appreciate all the work you do for helping everybody keep their teeth. Thank you.
And I'm going to echo all those comments. Thank you for the work you do and bringing this proclamation so we can raise awareness.
Yeah.